They have Dato. Dato is an award by the king, in Malaysia. His father is one of the Dato, holding the Dato title. And then he told me that my son is not going to work. He's a doctor, continuously taking leave, and staying at the room, not coming out, only coming out for the lunch time. Come out, eat, and then go back. We don't know what he's doing there inside the room. Then ask him, how about is he alcoholic? He said, you take, yeah, he can consume alcohol, but he's not alcoholic. Do you take drugs? No, sir, no drug. Are you sure? Sure, because there's no symptom of taking drugs. Then any other issues? He got a girlfriend, also a doctor. She left him within 3 months. First, initially, I thought maybe due to the failure of love, is in maybe in a depression. He's not interested to go to work. Initially, I was thinking that. When I was speaking to him, when he come to one counseling, then I asked him. Normally, during the counseling, we check the childhood trauma, whether there is any, yes, encounter any childhood trauma. That's very, very important. You all can go to the website, look for adverse childhood experience, ACES. That's one questionnaire, standard statements of 10 questions. You can test with your clients or test with the whoever, children, whoever is it. If they can answer the 10 statement, if they say answer yes for one statement, they fall under 30% in the risk category. For example, I read one question to you. Did a parent or other adult in the household often or very often swear at you? Sometimes they speak bad words, uh, a lot of things, insult you, put you down, humiliate you, or act in a way that made you afraid that you might be physically hurt. It's one statement. If a child said, a student or secondary school, even adult, married, whoever is it, said, yes, I have experienced this. They put S, automatically they fall under 30% is a risk category. There's high possibility for other issues. Okay. You can go and check with the ECA in the net, because when I was in the US, I was trained for this. Okay. Whoever come, clients, any clients, whether they are what type of profession, first I check the childhood. Childhood is very, very important when you are doing counseling. You must focus on that. If they have encounter bad childhood, definitely that traumatic experience I would have changed your mental health, affected mental health and personality also. Okay. So my clients mostly a lot of professionals encounter marital issues in Malaysia. The divorce rate among non-Muslim, because in Malaysia we call it Muslim and non-Muslim. There are two categories. Muslim mean mostly Malays. Malays are Muslim, and even Indians. Also, some Indians or Chinese also Muslim. They fall under Muslim faith. Non-Muslim Hindus, Buddhists, Sikh, and Baha'i, whoever is it, all that religious group fall under non-Muslim. So the divorce rate among non-Muslim, highest among Indian is 70%. Highest is among Indians. So divorce affect the child's childhood. Okay. And then when I'm referring to that doctor, he told me, what is the reason, sir, doctor? You don't go to work. So he was talking to me, giving a lot of excuses, this and that. Later I found out why your girlfriend, so-called girlfriend, left you within 3 months. Then he told me that I cannot get along with him, with her. I get along with her. Why? What is the reason? Give me specific reason why you cannot get along with her. He told me that sometimes there's a tendency, sometimes I abuse her. I torture, not abuse, torture her. He told me I will torture her because of that. Maybe he left me. Torture mean what type of torture? Will be more specific. Even torture must be very specific. What type of torture? Give me an example. He told me when I call her, when she don't pick up the phone, I will continuously calling her. Do you think that will be a torture for her? Continuously I call her. Then I asked him, your girlfriend is a doctor. She may be in operation theater with a client, with a meeting, whatever is the possibility. When she don't pick up, you should understand that maybe she's busy. She will call you back. Can't you think like that? She quiet. Then I asked him, are you suspicious about your wife? She's not giving importance to you. Maybe she have communicating with another person, not prioritizing your call. Then he say yes. Then next question, are you taking drug? Do you take drug? He was quiet. Then I told her, doctor, I've seen many of doctors. In Malaysia, the peptamine, there's one peptamine, we call it a technical name, that's not difficult. Commonly they call ice, in Malaysia, easily available, expensive. They take this ice, even as university students also, they take because they can, without sleep, they can stand and work or read or write, whatever is it, for that they take ice. So that person was taking ice. He told me, I'm taking ice since age of 18. Then I was surprised. You become a doctor. You're taking a drug since you're 18. How you managed to complete your MBBS degree in Russia? He told me instead of 5 years, I spent 8 years to complete my MBBS degree. Okay. For housemanship, 2 years in Malaysia. He able to complete within 4 years. Unable to complete because he is continue taking drug. He told me when during the counseling, sir, even yesterday I took the drugs. I have no money. So what I did, I got a Benton. I give to my friend as a charity, and then he gave me 300 Malaysian ringgit to buy the drug because I cannot ask my father every day. But father don't know. Father don't know why he is asking for money. Then asking him, why should you take drugs? When you're taking drug, definitely you have a lot of worries. You are coming from well-to-do family. You are only one child, so nothing to worry in your life. You should be having a happy life. When a person having a happy life, definitely they won't go for drugs or whatever is it. Then he only told me, sir, in my life, I did not get loving and caring parents. He told me, no loving, caring parents. Nobody there to listen to me, sir. After school, during my primary and secondary, I spent with my friend's house. I returned back in the evening. My parents also returned back. My mother will be cooking. My father was doing his office work there. There's no communication. We don't communicate. Once the food is ready, the dinner is ready, we three of us, we will sit and eat. After eating, they go to their room. I go to my room. That's my childhood. It's all trauma. It's all trauma. So he become a doctor, but life fail in life. He's become addict. So I send him to a psychiatrist for a follow-up session. So childhood, and also because this fall under another feeling no one love the child, no close to each other, no supportive relationship. He fall under that category. There's another uh, trauma or the childhood experience. Another one is not enough food. Sometimes the poverty. not enough food to eat, wear dirty clothes, no one to protect me. That also adverse childhood. And alcohol and drug addicted parents in family. Okay, and parents separated or divorced or extramarital affairs. But in Malaysia, a Muslim is allowed to have more 4 wives legally, but non-Muslim Hindus and others, they only can have one wife or one husband at a time. Either divorce or demise of that life partner, they can remarry again. But in Malaysia, they have done studies say Indian men's having more than one wife. So yeah, but not legally lah. Not all, but high percentage of the person having affair, marital affair, because there's a issues on marriage. So the tendency to live in the empty shell marriage. Those living in the empty shell marriage, there's a possibility for extramarital affair. So when there's extramarital effect, that affect the children. The children will undergo whether they are a well-to-do, the millionaire family can be a millionaire family. That's different. But poverty in relationship, you are a millionaire, but poverty where? Where is the poverty? Poverty in relationship that affect the child's mental health and brain system. Okay. Another one, mother or stepmother physically and emotionally abused. If they have witnessed such incident, that affect them. That affect the brain system. Scolding, offensive word, insult, put down, and humiliate. And family members are depressed or mentally ill. Sometimes there's a possibility for family members attempted suicide, either mother or father or close member of the family. That would have affect the child also become a trauma. So all this is a trauma. So the studies, neuroscience based, is all based on neuroscience. That's the latest. Neuroscientists have come out with the ACE, and also how it impact the brain system. So one is it affected the brain system. It affect the education, the behavior, the education, and also later part career, and also the marriage life. So this impact continue till death, unless and until that person realize I have a bad childhood, I have issues on personality, issues on mental health. It must be corrected. I need to transform myself, get professional help, and transform himself. Maybe he can have a happy and a healthy life. So there's one studies based on the ACA. In the statement of 10 statement, there's a 10 statement in the ACA questionnaire. If you a person answer 4 yes, for 4 statement you say yes, then 2 times more likely to smoke. Okay, 7 times more likely to be alcoholic, and 6 times more likely to have sex before age of 18. They have done all that. Okay, they're all based on study, evidence based. This is not imaginations, you can go explore, and a lot of books on that also. You can buy books. A lot of research have done on the importance of childhood, how the impact of childhood traumas. Okay, many books. Another one, male children with the ACA, adverse childhood experience, or 6, if they have for the in the statement of 10 for. So what is interpretation is, there is 4,600 times percent increase likelihood of them later becoming an injected drug user. They do injected drug user. Okay, and then teenage pregnancy. If you come across cases of teenage pregnancy, you can check the childhood. Let me share one case. One case. This one, I think 17 years old, 18 years old girl, a girl came to me with a 17 days just born, child baby with a baby. She's a mother of a baby of 17 days. Her age was 19. At the age of 19, she got a child. Why she came to us, our organization, looking for help? She need money to buy milk for the child. Okay. Then I spoke to the girl for nearly for 2 hours to find out why her life was affected. At this age of 19 years old, she became a single mother without husband. Then I find out he came from a dysfunctional family, lot of childhood trauma. Her father is a alcoholic, always whenever you're drunk, always scold this girl using bad words, chase the girl out. She's the elder in the family. So the total childhood was very abusive, neglected, unhappy childhood, bad childhood. Then what happened when she was about age of 16, I think 16 plus 16 or 17, around 16 or 17. She always very sad child in the secondary school. Her friends advise them, you are very always, you feel like sad, worries, you're not happy, you look very sad. Why not you go to the FB, you open up a FB file, Facebook, you will get a lot of friends. So you can enjoy life with the friends, lot of friends. Then also she got a profile, FB. She opened up a FB account. And then what happened? Lot of friends was say all positive word. In the head home, what happened? Every day, negative words, abusive word, dirty words by the father. But here, boys all telling, oh, you look like Aishwarya Rai. You're very pretty. This and that, all positive. So her love tank was empty because of father. Here, the FB friends, they're posting all positive words. So that positive word become deposit to a empty love bank. So she was attracted to one boy. Within 3 weeks, attracted, they communicated, exchanged phones. After 1 month, the same incident happened in the house. And then she was very worried. Before, there's nobody to share her feeling. Now I got somebody, is a boyfriend. So she shared to the boyfriend. When he called, he shared to the boyfriend. So the boyfriend said, don't worry, I'm here. I can take care of you. She is about 300 kilometers away from that boy. You see, you just take a bus and come back. I'll take care of you. She also left her family. It's a runaway. It's called case of runaway. Also fall under teenage pregnancy because of the childhood. So come back after 1 month. He was taking good care. Love and care is there. And then they decided, why not we tie up tali, put the small temple. There's many temples are here. Put the temple, tie tali. And then I asked her, what happened the next day? The following same day, we had a dinner. After that, he went back. What happened? She was quiet. Did you have a sexual relationship? The first sexual relationship? He said yes. After that, that person didn't go. He didn't go to work. His main focus sexual relationship. So she became pregnant when she was 8 months. That boy left her, and then when I met her with a 17 years old child, baby. This all due to the child, the trauma. Although this coming from dysfunctional family, although not a well-to-do family, but whether you're a family, I mean well-to-do family or not, you have all the cultural background, all good. But when there's a relationship failure, if the child did not experience a very healthy childhood experiences that affect the brain system, they may encounter other issues in later part. Okay, that's all. Then another one, ACA. This you can try out this. ACA is important whenever you're involved in counseling. You can try, you can get a questionnaire and then ask them to fill up the form. You read out or let them. It's in English. You can translate in whatever language that the clients understand. Then you can explain to them to answer to know the emotional stability of them. That's very important. They can be any profession, whether the childhood's impacted the current adult life or not. That's important. Why they have a problem? Definitely, a child with a healthy childhood experience, definitely most of them don't encounter such issues. When I was in India, I was with Professor Balakrishnan. I was training on these assessment tools. There's one girl came, age of 6 years old. The reason why she's not interested, go for school refusal. So even the school refusal also there's a uh, factors. I mean possibility for traumas. Okay, why? Then we asked the girl why you're not interested going. She's quiet. Then what the psychologists in the office, they tested her for haiku test. First we did the haiku test. When haiku test, the result come 110, 110. She's beyond uh, average. Average is IQ is a 90. I think that's a normal. So it's a 110. Definitely she will be a super kid. Academically, should be doing well. But she's not interested to go to school, not talking to the family, focusing on video games. Video games. Okay. Then we did another test, mental health. That test revealed that she is having a depression. She's a depressed child. The age of 6, we are wondering why is the age of 6 also got depression. Then only we come to know the reason. The parents are divorced. I think about 6 months ago, the parents were divorced. She has an urge to meet the mother, but father don't allow her to meet the mother. So she was undergoing a depression. So unless you don't take care of the child, future will be affected because the brain system will be affected by the childhood trauma and also what you call the current depression. Okay. So this let me I think we got the time, is there? You want to do questionnaire or what? Q&A? No Q&A, isn't it? Can I finish this one case? I give you one case, the childhood trauma. That's very important classical case. Definitely, you know John F. Kennedy. Okay, the president of America, John F. Kennedy. His brother, Robert Kennedy. This case referring to Robert Kennedy's granddaughter. Her name is Cyrus, difficult to pronounce his name, her name. Cyrus Kennedy Hill. Okay. At the actually she was studying in the best school in the US, well respected student in school, and she have with the mother, she did a lot of social work during college days. Okay, very intelligent, well respected child. But at the age of 22, she commits suicide. I don't know whether you come across this case, but this there's not fully full. They didn't explore much. The media also didn't do much coverage. Okay, okay. But age of 22, she commits suicide. What is the reason? What is the reason? Somebody reason. Any questions? If I proceed, question or can I continue? Okay. At the age of 22, died of drug overdose, including alcohol, on 1st August 2019. It's during COVID time. It's not the root cause of COVID, you know. Studied in Dear Academy, prestigious and oldest higher secondary school in US. Parents married in 1993. She born in 97. Parents are separated. You check for the trauma. The case is reflecting. I'm referring this case because of the trauma. The trauma effect can infect the top, even the #1 family in the country. Anybody will be affected. The parents separated in 2006. Her father, Paul Michael Hill, was falsely accused and imprisoned for 15 years before his conviction was overturned. So a very, very bad childhood, but very intelligent. But because due to the failure in love failure is very common. If she is mentally healthy, emotionally stable, definitely that failure will not affect her, would not have affected her, because she is very vulnerable because of the childhood trauma, bad childhood, adverse childhood experiences. She was vulnerable, so she was very emotional. Her prefrontal cortex, the rational brain, was not very active. It's not activated because of the bad childhood. She has made a decision based on emotional brain. Okay, because of the failure, she commits suicide. Okay, you can go to the net and find. I don't know whether it's still that story is all available in the net or not. I don't know. The childhood trauma. That's why for those doing counseling, even psychologists or counselor, whoever is it, you must give focus to the childhood. When I was in Sri Lanka, there's one organization. They are requested me to conduct for the psychology intern student on childhood trauma. So there, it was well received because of even most of them also experience the childhood. Even you go to the check with the college student, they when I was in India last February, I was giving a talk at the Madurai American College. I think you all should know Madurai American College. So I was one of the speaker. So when I spoke about the childhood trauma, so no, most of the students raise up questions. Okay, they come forward. They said uh, uh, how it affected their life, and also currently the situation in the family. Say, there's one girl told me, "Sir, I have nobody there to communicate in my family. My mother is a single mother. She's always in the phone, play game or whatever, communicate in the phone. I have no time. I cannot speak to her. Whenever I go near, you say, wait, I'm busy." She's a undergraduate psychology undergraduate student speaking to me at the conference. There's many cases like that. This is all childhood. Okay, childhood trauma. Definitely, she would have come across that childhood bad experiences. Now, at the age of I think she's 19 or around there, doing the first degree. psychology, MSc psychology, sorry, BSc psychology. But most of the students, I think more than 20 students, during my session only, many students raise up and question me, all focusing on their emotional stability, emotional issues. So my conclusion is, our childhood already, the upcoming children's, the future of this country, the children of the country, they must have a good, healthy parenting. I mean, healthy life with their parents. Very important. Even they are coming from poverty also doesn't matter, but not poverty in relationship. That's very important. That can save the children and can bring a healthy citizen of the country. You can give a focus much to education, okay, but the childhood trauma have very bad impact on the brain system. That's important. This is a strong message to the community. I think that's all. I think it's enough for me to share with you all.
Any
Thank you.
questions or clarification they can ask?
Yeah.
I think.
Good evening, sir.
Go ahead.
Yeah, good evening.
Thank you very much for very enlightening perspectives. Sir, once we come to know that child has gone through some traumatic conditions in their childhood, so what are the 1, 2, 3 steps to advise them to come out of that, sir?
Actually, first must explore what are the childhood traumas. That's important. First, for example, psychology is sitting with the person. You must find out what are the childhood experiences that they have experiences. So based on that, now only the cognitive behavior therapy, CBT. So there's a need to change because they don't realize during the childhood it happened, but it impacted the brain system. Now they are vulnerable. They won't realize that, but there's a need to explore the past life. Past mean the experiences, whether it's impacting them now, and then what are the current issues. Just focus on the current issue. Why you have any behavior problem, whether you have anxiety, whether you have a depression, or you have any other issues, whether that need a medication, or without medication, the cognitive behavior therapy itself can solve most of the problem. We need to talk to them, explore them, and then see. There's no, I cannot say the step 1, step 2. First, speak to them and find out, explore the issues first, and then they must be in the position to, the thought process, they must be in the position to overcome the issues. We have to empower them through counseling, through therapy. We have to transform their thought process. That is important. With otherwise, even you can teach them 1, 2, 3, this step, it's difficult unless they speak to a professional who have experience in handling traumatic. I mean, those with traumatic experiences. This trauma counseling is a very serious counseling, very important counseling. Not all train on that. Okay, but unless they can share, and then the professional can guide them to transform their thought process to the positive, it can be changed. Even they have very traumatic issues also can be changed through the thought process. They need to change. For example, when you're driving a car, when a girl cross wearing sexy dress, speaking to the phone, suddenly she cross. When you're observing that lady, definitely you will get angry. What do? You shout at her, or a sudden break to her, threaten her. But another incident, you're driving, suddenly a old blind man crossing the car, your car. So at this time, your thought process will change. Empathy is created. You may stop, you may help him to cross the road. So thought process can change the behavior. So we focus on what is the issues. Maybe they have a trauma, but now they don't have any behavior issues. There are no issues at all. I mean, no problem. Unless they have pestering issues now, then CBT is the best method to transform their thought process. Thank you.
Thank you,
Sir,
sir.
I have a doubt, sir. Can I talk,
Yeah.
sir?
Yeah,
Sir,
yeah.
now we have discussed about the children who had been suffering the trauma after divorce. Now, what is the role for, suppose there is a case that has come to me that parents are separated. There is no official divorce. They are living separate, wherein the mother is living separate and the two daughters are living along with the father. And for this, what is the role of that mother to contribute to the two daughters, because they have already a suicide in their family, whatever the reason is. Now the mother is worried that how can she support the children? They are 16 years old. They have completed their intermediate, and now she wants to know how can I support my daughters. The daughters are not favorable towards the mother, yet they come down to their mother, talk and go, but they are not connected completely with the mother. They just hold the anger that she left. But the mother's explanation said she can't live in that toxic relationship because, first of all, she need to survive herself. How can that mother support the children?
Whether first we must speak to the children, the child, whoever teenagers, she as a professional, she must speak to them what their need. Whether they like their mother or not, sometimes they're very angry with the mother. So when she's have a very strong anger against the mother, there's no point of mother, even she is on the play some important role to help the children. Sometimes the children don't need the mother, they hate the mother. So now we have to empower the child, the issues, explore the issues. So what they need, speak to them, and how they can take care of them, because they are 16, 17. If they are like the mother, even if she like mother or father, okay, even they separated. But for example, sometimes the daughter may like father, separated. Now is he living with the father or
They are living with the father, sir.
father? Okay. Another thing, must check with her whether they're having a very good relationship with father or not. Whether healthy relationship with the father or not is important. Maybe living, he can provide, father can be a good provider, but there's any emotional attachment, that's
No,
very
sir.
important. No mean, definitely we have to empower the child. We have to speak according to their need, then only we, otherwise even the parents, both parents, mother or father, they are not relevant to this child now. Okay, so we have to empower, and also we have to look for any, whether they like to live with any other family, very close friend, uncle, auntie, or grandparents, whether they like. Maybe there's a second option. If that option is there, I feel that I want to live with my grandfather or grandmother or my uncle. Maybe that change of the place will